In this final online lesson, I will present the major muscles located in the lower leg, which move the ankles and toes. Listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. These will again be displayed at the end of the unit for your review. A very important movement in the ankle is plantar flexion, which is bending the ankle forward to point the front part of the foot down. This is very important in walking, as when we place each foot on the floor, we then need to plantar flex the ankle in order to push off with that foot to move forward. This action also assists us in jumping and, as shown in this diagram, to be able to press on the accelerator or brake when driving a car. There are two major muscles which make this happen, the gastrocnemius and soleus. In addition, there are 5 other muscles which assist this movement, as shown on this slide. The gastrocnemius is the largest and most superficial of the muscles on the back of the lower leg. It is a major plantar flexor of the ankle, but as it crosses the back of the knee, it also assists with flexion of the knee. It originates on the condyles of the femur, which are found on the back of the femur at the lower end, and it inserts on the calcaneus or back of the ankle bone. The soleus is also a strong plantar flexor of the ankle as its only function. It originates on the posterior tibia and fibula near the knee, and also inserts on the calcaneus or back of the ankle. The next 5 muscles assist with plantar flexion of the ankle, but will also be mentioned again in this lesson for their other movements. It may be best, as they are first seen for ankle plantar flexion, to record all their movements in completing the assignment chart. The fibularis longus assists in plantar flexion of the ankle and originates from the upper region of the fibula. Its tendon reaches down and under the foot to attach to the first metatarsal or toe bone and medial cuneiform bone on the inside of the foot. The fibularis brevis assists in plantar flexion of the ankle and originates from the lower region of the fibula. Its tendon reaches down and attaches to the 5th metatarsal or bone of the little toe. The tibialis posterior assists with plantar flexion of the ankle as it originates on the upper back side of both the tibia and fibula and inserts on many bones on the bottom of the foot, including the middle 3 toes. The flexor digitorum longus assists with plantar flexion of the ankle and is named for its action to flex the toes. It originates on the back and middle region of the tibia and inserts on the 2nd through 5th toes, or all the toes except the big toe. The flexor hallucis longus assists with plantar flexion of the ankle and is named for its action to flex the big toe. It originates on the middle of the posterior fibula and inserts on the big toe. Ankle dorsiflexion is a weaker movement of the ankle as it is mostly used to simply lift the foot, so there are only 3 muscles which assist this movement. These 3 muscles will also be mentioned again in this lesson for their other movements. It may be best, as they are first seen for ankle dorsiflexion, to record all their movements in completing the assignment chart. The tibialis anterior is the strongest muscle used for ankle dorsiflexion. It originates on the upper surface of the lateral tibia and inserts on 2 bones at the base of the big toe. The extensor digitorum longus is named for its action to extend the toes, but it also assists with ankle dorsiflexion. It originates on the upper anterior fibula and inserts on bones of the 2nd through 5th toe. The extensor hallucis longus is named for its action to extend the big toe, but it also assists with ankle dorsiflexion. It originates on the middle anterior fibula and inserts on the bones of the big toe. Ankle inversion, or turning the foot inward, and ankle eversion, or turning the foot outward, are mostly important for maintaining balance. You can see this importance by trying to balance on one foot. As your body may tip from side to side, you use the muscles that invert and evert the ankle to help maintain your balance. There are 5 muscles mentioned previously for either ankle dorsiflexion or plantar flexion that enter the foot on the inside of the ankle. These 5 muscles then also assist with ankle inversion, as noted in the next 5 slides. The tibialis posterior, which was previously shown to assist with plantar flexion, enters the foot on the inside of the ankle and therefore assists with ankle inversion. The flexor digitorum longus, which was previously shown to assist with plantar flexion of the ankle, enters the foot on the inside of the ankle and therefore assists with ankle inversion. The flexor hallucis longus, which was previously shown to assist with plantar flexion of the ankle, enters the foot on the inside of the ankle and therefore assists with ankle inversion. The tibialis anterior, which was previously shown to assist with dorsiflexion of the ankle, enters the foot on the inside of the ankle and therefore assists with ankle inversion. The extensor hallucis longus, previously shown to assist with dorsiflexion of the ankle, also enters the foot on the inside of the ankle and therefore assists with ankle inversion. Ankle eversion is accomplished by 3 other muscles which were mentioned in the first part of the lesson, as they also either assist with plantar flexion or dorsal flexion of the ankle and enter the foot on the outside of the ankle. The fibularis longus, previously shown to assist with plantar flexion of the ankle, enters the foot on the outside of the ankle and therefore assists with ankle eversion. The fibularis brevis, which was previously shown to assist with plantar flexion of the ankle, also enters the foot on the outside of the ankle and therefore assists with ankle eversion. The extensor digitorum longus, previously shown to assist with dorsiflexion of the ankle, enters on the outside of the ankle and therefore assists with ankle eversion. Lastly are the flexor digitorum longus and flexor hallucis longus, mentioned previously as assisting with ankle movements, but their major function is to flex the toes. There are also the extensor digitorum longus and extensor hallucis longus that assist with ankle movements, but their main function is to extend the toes. The flexor digitorum longus, which was previously shown to assist with ankle plantar flexion and inversion, has the major function to flex the 2nd through 5th toes. The flexor hallucis longus, previously shown to assist with ankle plantar flexion and inversion, has the major function to flex the big toe. The extensor digitorum longus, previously shown to assist with ankle dorsiflexion and eversion, has the major function to extend the 2nd through 5th toes. The extensor hallucis longus, previously shown to assist with ankle dorsiflexion and inversion, has the major function to extend the big toe. As at the beginning of the presentation, listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. It is suggested that you should begin to study for a test on these muscles by using study cards with the name of the muscle written on one side and the actions and attachments of the muscle on the other side.